Welcome to a continuation of your Chapter 7 video lectures. Here we're going to talk about Section 7.6 on regulating blood calcium levels. Here are your learning objectives. Our body absolutely needs to regulate our calcium concentration within our blood. We need our calcium to initiate muscle contraction, to allow exocytosis to take place of certain molecules from cells, and this includes within neurons to release neurotransmitters. Also in stimulation of our heart by these pacemaker cells over here, and also within blood clotting. Now there are two primary hormones that help regulate blood calcium, and that is calcitriol and parathyroid hormone. So we'll start off with talking about how we activate vitamin D to calcitriol. So first, UV light is going to convert 7-dehydrocholesterol to vitamin D3. And you can see that this is going to take place within our skin, or we can also get that from our dietary intakes, such as within our milk. And then that is going to be absorbed from our small intestines. Now vitamin D3 is going to be converted to calcitiol by the liver enzymes, and both steps 1 and 2 are going to occur continuously with limited regulation. In step 3, we'll have calcitiol circulate within our blood. It is converted to calcitriol by our kidney enzymes. And then our parathyroid hormone will increase the rate so that more calcitriol is formed. And calcitriol also stimulates absorption of calcium ions from the small intestines into the blood. Now for our parathyroid hormone. This is secreted by our parathyroid glands. You may not have heard of them just yet, but they sit on the posterior aspect of our thyroid gland that we find within the neck region. They are going to respond in instances in which our blood calcium levels are too low. So it helps to accelerate the conversion of calcitriol by the kidneys. We'll have our parathyroid hormone and calcitriol interact with some major organs. First, it interacts within our bones, and that will increase the release of calcium from our bone into the blood by increasing the osteoclast activity. So our osteoclast will resorb the bone, releasing the calcium into the blood. And then within our kidneys, we are going to have them stimulated to excrete less calcium in the urine and increase the calcium reabsorption that can take place. And our small intestines, only calcitriol will increase the absorption of calcium here from our small intestines into the blood. A quick clinical view here on rickets. This disease is caused by a vitamin D deficiency in childhood, and it's characterized by deficient calcification of osteoid tissue. You can see that it gives children this bow-legged appearance, so you could see it over here, as well as within these children in the photo in black and white. And we have disturbances in growth. We have hypocalcemia, which is a reduction within calcium in the blood, and tetany, which are cramps and twitches that take place. These are all caused by low blood calcium. And it occurs in some developing nations still, but the incidence does not happen in the US as much, but there are some incidences increasing in urban US children. Now for calcitonin. So a lot of cal names here. This one is a hormone to be aware of, and it's going to aid in regulating our blood calcium levels, of course. We will have calcitonin serve in a less significant role than in parathyroid hormone. So just as a reminder, that parathyroid hormone is released when we have too low levels of calcium within our blood. That hormone gets secreted, osteoclasts get to work, resorb that bone, and release calcium, along with some other things that happen within the kidneys and small intestines that we talked about. And then we are back to our homeostasis level. Now, with calcitonin, what's going to happen is we have too much calcium within our blood, and calcitonin is released by our thyroid gland. This can also be secreted in response to exercise, and its job is to inhibit the osteoclast activity. It also will stimulate our kidneys to increase the loss of calcium within our urine, thereby reducing our blood calcium levels, helping to bring them back to homeostasis levels. The greatest effect is going to be during the greatest bone turnover, which would be in growing children.